Read this motion into the record. I move that the Standing Committee on Public Accounts report to the House requesting that the House authorize the Speaker to issue his warrant for the appearance of Chris Mazza, former President and CEO of Orange, before the Standing Committee on Public Accounts in room number 151, Legislative Building, Queen's Park, Toronto at 9 a.m. on Wednesday, May 16th, 2012, that if necessary, the warrant can be served to Dr. Chris Mazza's attorney, Roger D. Yacchetti, QC.
Thank you for that. And I just have a comment on the procedure, and that is the only concern, and I'm not going to comment beyond this, is that in the past, the procedure followed by various standing committees when requesting the authorization of the House for the issuance of a warrant has been that the committee would communicate with the individual or individuals on at least 2 occasions and have 2 refusals in front of them. I understand that has been the procedure in the past. We have not followed that procedure up to this point. I'm laying that on the floor, and whatever the committee decides is the appropriate course of action, so be it.
Speaker, if I might, I think that we're all in agreement that Dr. Mazza should be called. We are running out of time. We only have 1 day a week of hearings. We're bumping up to the legislature rising. I think that we have enough information. Dr. Mazza has been advised that there is an interest for him to appear, and I would recommend to the committee that we move forward, we pass this motion so that we can get the debate in the House underway.
Further comment? Ms. Sandos?
Just to say that we are in agreement. The public motion to invite Dr. Mazza to appear has been on the public record for quite some time. And I think it is important that we move ahead in trying to get him in here to testify, because ultimately he's the key person that we need to talk to.
Thank you. Ms. Jellens?
I would agree with everything that has been said, that we start the procedures with the Speaker warrants immediately. That does not preclude us from continuing to connect with Dr. Mazza and invite him to come, but the procedures for the warrants have to be started today.
Okay. Mr. Zimmer?
Question to the clerk. That business about making 2 requests before, is that a condition precedent to issuing the Speaker's warrant or not? Because if it is a condition precedent, then by the rules you can't issue the warrant until the request has been made, and then if a lawyer gives them that advice that the condition precedents were met, the warrant is of no validity, and then you're going to be behind a month. I just asked the clerk if that you better be careful about that.
Yeah, so it's precedent or procedure that's been followed in the past. However, it's not necessarily stopping the committee
from... So it's a protocol, not a condition precedent.
Correct.
Okay,
yeah.
Thank you.
Okay, any further debate? Seeing none, all in favor? Carried. Okay, then we'll go to our Ms. Sandals.
Motion that I would like to table.
Okay.
If I may, this is with respect to witnesses.
We have 2 other motions as well.
Okay.
But we'll
so
table
you're going
it,
to deal with the other 2 first?
If we won't, we don't have time to discuss them right now, but because we're going to get on with our afternoon's proceedings. But if you want to table it, that's fine.
Are we doing? No, we're not debating any of them right now. Okay.
No.
Oh, can I save 1 copy? Yes.
Okay, so we should.
So I can
Yes,
advise my fellow members, this is a motion to have Kelly Mitchell to appear, because it turns out that he was simultaneously on the board and being paid as a consultant at Orange, which would seem to attract some attention from the auditor.
Very well. So now for our first witness this afternoon, we have from the Ministry of Health and Long-Term Care, we have Malcolm Bates, Director of Emergency Health Services. Mr. Bates, if you could please come forward. And I understand you've already sworn an oath, so just remember that you are under oath and you've received the letter with advice for a witness appearing before the
I
committee?
have.
Thank you very much. And I believe it's time for the, well, you have 5 minutes for an opening presentation, and then the government will go first with questioning this.
Thank you very much. Good afternoon. My name is Malcolm Bates. I'm the Director of Emergency Health Services Branch, the Ministry of Health and Long-Term Care. Thank you for this opportunity to address the Standing Committee on Public Accounts with respect to the Auditor General's report on Orange Air Ambulance and related services. Today I'll focus on what steps the Ministry has taken and is taking to respond to the issues raised by the Auditor General, in particular with respect to patient safety. The Emergency Health Services is charged with exercising some of this oversight over Orange. The oversight conducted by the branch includes a requirement for certification which Orange must undergo every 3 years. This is augmented by unannounced inspections and by investigations of complaints. In addition, the Ambulance Act contains multiple standards related to documentation, patient care, and storage of controlled substances that each operator must adhere to. Orange is also required to submit ongoing financial reports and audited statements. Until late in 2001, many indicators led the Emergency Health Services branch to conclude that Orange was providing good and financially effective service. A comparison of land and air ambulance costs showed that Orange's costs were in line. A comparison of investigations conducted in land versus air ambulance also showed that Orange was in line. Orange passed its certification reviews. A review conducted by an external audit firm found that Orange was using provincial grant funding economically, efficiently, and for the purposes intended. Thanks in part to the information uncovered by the Auditor General, we now know that Orange misled the Ministry on a number of occasions. Furthermore, in January 2012, Orange itself informed the Ministry that the organization had deliberately inflated the number of patients transported over the years since it had assumed full responsibility. The Ministry had relied upon these reports to assess requests for funding. As a result of these revelations, an amended performance agreement with Orange is now in place. The agreement includes more stringent and detailed monitoring, control, and reporting obligations on the part of Orange. Orange is required to submit a number of operational reports to the Ministry monthly. For issues affecting patient safety and for complaints and investigations, Orange must provide information to the Ministry immediately. The Ministry will then assess the need for further investigation. As well, the performance agreement provides for a greater emphasis on performance standards and includes enhanced key performance indicators with expanded reporting requirements. Under the amendment agreement, Orange's funding and executive compensation are tied to performance improvement targets set out in an annual quality plan, as is the case for other transfer payment agencies, including hospitals. And new provisions link Orange's performance during 1 year with funds provided by the Ministry in the next year. The Ministry has also taken action to ensure that Orange's internal investigations protocol will be improved. In this regard, the Ministry's Manager of Investigations has provided advice to Orange quality assurance staff on investigative techniques and will be providing additional training for them in the area of good investigative methods. With respect to aviation safety, the Ministry of Natural Resources has recently initiated a safety review of Orange's rotary wing ambulance operation. These steps build on recent achievements by Orange's new leadership team, appointed in January this year to provide trustworthy administration focused upon safe delivery of air ambulance services in Ontario. Once again, thank you for the opportunity to speak to you, and now I'd be pleased to take questions.
Very well, thanks for that. And the government gets the first opportunity to ask questions.
That's because my mouth is full, right?
Ms. Sandals?
I knew I'd get
When
in
you get
trouble
it-
when
when
I
you get-
stole a cookie.
When you're ready.
Mr. Bates, you've been with the Emergency Health Services, the branch, and specifically the air ambulance responsibility for a number of years. If we go back into sort of the history of all this, what concerns were there that first prompted, and maybe you could outline to us how it used to work, and then the creation of Orange or OAA, whatever it was initially called. But how did we get from here was the old structure, here were the concerns, and here's the new structure?
Yes, of course. Prior to 2006, when Orange assumed full responsibility for air ambulance services in the province of Ontario, the Ministry of Health was, in fact, responsible totally. The Ministry of Health utilized several different components to provide air ambulance service, one of which was the administration was with the ministry, one of which was the dispatch was operated by the ministry, one of which was the aviation and the paramedic services, which were outsourced to contracts in the private sector, and one of which was a base hospital, which was provided by Sunnybrook Health Sciences Center. In 2003, there was an approach by Dr. Mazza and his team requesting that the air ambulance service be consolidated, and that is putting together all those various parts of dispatch, the base hospital, the aviation, the paramedics, and the base hospital into one consolidated unit. And at that time, Dr. Mazza and his team made a presentation to the Red Tape Commission. The Red Tape Commission looked upon that very favorably, and it was moved forward to the point at which legislation was, I believe, drafted, and the intent was to change the Ambulance Act to allow for this type of consolidation of air ambulance in 2003. At that point in time, the election occurred, as many of you probably remember, and a new government came into place. The initiative by Dr. Mazza and his team continued under the new government, and Dr. Mazza was in fact the lead for the implementation of this consolidation and all aspects of it. And the staff of Emergency Health Services and other parts of the Ministry of Health were directed to work with Dr. Mazza to ensure that he had sufficient information in order to proceed with the consolidation initiative. The government approved the consolidation with Orange taking full responsibility in 2005. A performance agreement was negotiated. In 2006, the performance agreement was signed between the ministry and the Orange, at that time called the Ontario Air Ambulance Services Corporation, and they took over full responsibility for all provision of air ambulances services in the province of Ontario.
So just to 2003, early 2003 would be before my time here. So just to go back then, at that point, Minister Clement would have been the Minister of Health, and there was a Red Tape Commission. So Dr. Mazza actually put forward the proposal to consolidate, and to the Red Tape Commission, which was more, just reading headlines, I think more of a political investigation, concurred with that. And you actually got so far as drafting legislation to fulfill the consolidation prior to October 2003?
The government drafted the legislation.
Oh, okay. Sorry, you weren't drafting, but legislation was being drafted.
Correct. That's correct.
Prior to October
That's right.
2003.
It was not finalized and it was not passed.
No. It was, well, I'm presuming it was never tabled, given that the legislature wouldn't have been sitting after June or something 2003, but the legislation
Yes.
was being drafted not by you, but by somebody else prior to October 2003.
Yes.
I've got my timelines sorted out.
You do.
And then I was on the scene, and I do recall that the auditor did a previous report on air ambulance service. So that previous report on air ambulance service would have been with respect to the old model of air ambulance service which you described. Is that correct? I don't remember the year. Oh, okay.
Yeah,
Thank
we
you,
did
Auditor.
it around 2005, and just at that time, a couple of our recommendations dealt with the need to establish really better lines of authority, and I think there'd been an accreditation review which also indicated there was a bunch of different people delivering the service, and there need to be more clear lines of authority. So I think in response to the recommendation at that point, the ministry came forward and said they were looking at establishing this corporation. And about maybe 9 months after that, the committee actually had a hearing, and we discussed those issues.
Yeah, because I think I actually think I first met you at that hearing.
I believe so.
When we were looking at that. So the accreditation report, then, what would have, you both seem to be helping me out, which is fine. When would the accreditation report have been made available or received by you or the government, whomever?
In the year 2002, 2003.
Okay, so that was probably, the accreditation report would have prompted the previous government to have a look at this, and then the auditor's report followed along in...
But in July 2005, that's when the ministry announced the creation of this corporation to basically establish the air ambulance service. And the accreditation review was started in late 2003. I think it probably reported in 2004.
Okay, thank you for the timelines, because I think that helps us understand where the conversation how the conversation evolved.
Yes, right.
So with the creation of the air ambulance of Orange, I'm going to call it Orange even though I know it wasn't that on the first day, what actually then changed as a result of the creation of Orange initially?
Subsequent to the announcement by the minister that Orange would be assuming responsibility and the performance agreement signed, Orange in fact assumed full responsibility. The base hospital was in fact moved from Sunnybrook to Orange. Orange assumed the contractual arrangements with the private contractors that provided air ambulance service and the paramedics, and Orange took over the air ambulance dispatch center and assumed full administrative responsibility and control over air ambulance services in the province.
Okay, and Dr. Mazza had the air ambulance base, hospital base at Sunnybrook, and then Dr. Mazza would still have been obviously the CEO in charge of the air ambulance base when it
That's correct.
to Orange. And I think I'm being told that my turn is up. Thank you very much, Mr. Bates.
Yes, thank you, Ms. Sandoz. And now we move to the official opposition. Mr. Klees.
Thank you. Appreciate your overview. I'd like to go directly to the issue of the consolidation that was anticipated by government. The term consolidation,
yes,
as it was intended under the previous government,
right,
to my knowledge, did not mean that Orange or whatever the air ambulance entity would be would get into the business of purchasing a fleet of aircraft. The consolidation that was intended was to ensure that the oversight and the lines of authority were consolidated, that there was in fact a response to the previous audit that indicated very clearly that there were some weaknesses in the system that needed to be addressed. Would you agree with that?
I would agree with that.
Okay. What has happened since then is that the term consolidation somewhere along the line became interpreted by somebody, and obviously it was Dr. Mazza, and clearly we heard this morning that a very brilliant lawyer who understands the complexities of corporate structure came up with a scheme that would not only consolidate operations, dispatch, and so on, but would go beyond that and would begin to internalize the actual ownership of a fleet of aircraft and would take on the responsibility of hiring paramedics. Would you agree with that?
Well, I'm not sure I would characterize it as a scheme, but in fact, what you're saying is probably correct.
Okay. Now, you indicated, you've made reference to the performance agreement. I have read the original performance agreement. I know you're intimately familiar with it. That performance agreement sets out very clearly lines of responsibility. Nowhere in that performance agreement that I can see, unless you can point me to it, does it in any way relieve the Ministry of Health, and specifically the Emergency Health Services branch responsible for air ambulance or ambulance services in the province. Nowhere in that performance agreement is the Ministry of Health relieved of its oversight responsibilities. In fact, there are very specific references to reporting that's required, to oversight responsibilities. Would you agree with that?
I agree that the Ministry of Health and Emergency Health Services branch have and had oversight responsibilities, and that oversight responsibility was basically set in line by the Ambulance Act, by the Performance Agreement, and by the Transfer Payment Accountability Directive.
Yes. You made reference to the fact that one of the responsibilities that the Emergency Health Services branch has is to investigate. And I believe that you referred as well to unannounced visits, which if you're going to do the job properly, then obviously you want to do those investigations in such a way that you show up, no different than Revenue Canada or others. How many of those kinds of unannounced inspections took place under the Emergency Health Services branch at Orange since its implementation?
Well, I think it's important to think about the total perspective of oversight.
Yeah.
All right, and that includes investigations, which are formal investigations. That includes unannounced inspections, and that includes what we call certification, which is a very thorough, comprehensive overall review, all right, of ambulance operators.
Yes.
That we perform every 3 years. We perform an initial one, which was done with Orange. We perform one 3 years thereafter, which was done with Orange. We have another one subsequent coming up in the month of May of this particular year. A comprehensive overview of over 100 aspects of ambulance service that are looked at by a peer group of people within the business, within the industry, who understand and who are experts in the provision of air ambulance services.
Okay. So specifically my question was, and perhaps if I could ask you to go back and provide the committee with the information about how many unannounced visits were made to Orange for the purpose of doing the inspections. If you could do that.
Yes, of course.
Okay,
but I should clarify, though, that there are more operators than just Orange that we have to do. There are contractor operators, standing agreement operators, as they are called, right, particularly in Northern Ontario, who provide aircraft and air ambulance services for the assistance of Orange when necessary, when Orange aircraft are not available or when the patient condition dictates that a standing agreement operator will be used. So we also do those types of reviews. Right. They also must be, before you can provide air ambulance service or any type of air ambulance service in the province, you must be certified. And they're all certified by our branch.
Now, on the line of certification, Chair, how much time do I have left?
You have a little over 2 minutes.
Okay. The certification issue.
Yes.
One of the very disconcerting aspects of what has taken place is that somehow the responsibility for certifying, for training paramedics, for certifying paramedics, and in fact for certifying other operators was somehow morphed over to Orange itself. And I'd like your opinion as to the appropriateness of now, under this current structure, we have an air ambulance service that actually is self-inspecting, self-certifying, and is training and also certifying its own paramedics without a third-party oversight for that responsibility. Can I get your thoughts on that?
Yes, of course you can. And perhaps I'll correct something.
Okay, please do.
All paramedics in the province must pass certification. They go through community college or a private college, all right, to gain their paramedic certificate. Then they must pass an examination set by the Emergency Health Services branch. Okay. They all do that. They're all checked as well for our background material, so we know all 7,000 paramedics must register with us, including all of those at Orange. So we certify those paramedics. We certify the operation of Orange and all ambulance services in the province. You are correct in the sense of the responsibility for paramedics and the supply of paramedics was in fact transferred by the government to Orange in 2006.
Okay. And what about the other operators? Is there a certification process that Orange has responsibility for to certify other providers?
And you just have 30 seconds.
I mean, and I can only interpret what you're saying, sir. Orange would look at their contractors, all right, and review those. But they are not the certification group. That is the Emergency Health Services branch. We are the only certifiers of ambulance services in the province of Ontario. And you cannot operate an ambulance service, Orange or any other ambulance service, without a certification approval from Emergency Health Services branch.
Thank you, and time for the NDP. Mr.
Yes,
Singh?
good afternoon, Mr. Bates.
Good afternoon.
Mr. Bates, so you were specifically responsible for the oversight of Orange amongst other organizations as well. Is that correct?
We are responsible for some of the oversight of Orange, not all of the oversight of Orange, because bearing in mind there's a great deal of oversight on Orange, including what we're doing here today.
Perfectly. And so part of your oversight would involve patient care, is that correct?
Yes.
And part of it would involve financially in terms of how much money is being spent and where?
Well, financially, yes, in terms of the coherence of Orange with the budget that is provided to them.
Perfect. In terms of just the setup of the way your ministry works, do you regularly check in with or report to the Minister of Health?
Directly to the Minister?
Yes.
No.
And how would you convey your findings or any issues with the Minister?
It is a bureaucracy, as you've been told, and we provide information through our, at various times, ADM, Executive Lead, but at this particular point in time, it's the Assistant Deputy Minister
Okay.
of
So
Direct Services branch.
you would check in with the ADM,
Yes.
and the ADM would then presumably pass on information on to the Minister.
I could not tell you.
That's fair. Did you ever receive any financial reports outlining the cost of salaries or other costs associated with Orange?
That is not the mandate of my branch.
Okay. Did you ever receive any reports on the cost incurred with respect to the ambulances or the helicopters themselves?
That would be the responsibility of Orange itself. As long as they provide service under performance agreement, they have the decision-making as to how they provide that service.
Did you ever oversee the way they provide their services by reviewing any documentation or reports provided by Orange to you?
Oh, absolutely. They provide numerous reports to us under the performance agreement, and under the new performance agreement, many more reports are required.
And in those reports, did you notice anything that was awry in those reports that you received?
I don't know what you mean by awry.
Did you notice anything wrong with the reports that you received?
Yes. As I indicated in my opening remarks, Orange misled us.
And how did you realize that along the way?
Orange, in January of this year, provided us directly with a notification that they had falsified the number of transports that they had made over the years that we had counted upon. And I might say the Auditor General also counted upon the information from Orange, because his data source is the same as our data source, and that's Orange.
In January of what year?
2012.
Okay. Okay. Pass it on.
Thank you. The first question I'd like you to answer is that we were provided at the end of March this year, a couple of weeks ago, with answers from estimates that dated from a year and a half. In estimates in 2010, we asked 42 questions about Orange. We're never given the answer till March of this year. Did you know that there were 42 questions about Orange in estimates that usually your branch would have handled?
I did not know that you had not received information, because when we are asked for information, we provide it as quickly as possible.
So you were never told that there were outstanding questions from estimates that had directly to do with your division?
No.
Okay, and do you know, since we were giving answers in March, did you know that somebody had given us answers to those questions in March?
When we provide information, and as this gentleman rightly said before, we provide it, if you want to call it up the line, we provide it to our Assistant Deputy Minister, and where it goes from there is basically a responsibility of another part of the ministry.
In your years of service as a civil servant, you're aware of the process called estimates, where the minister comes and you usually has the deputy minister, the assistant deputy minister. Sometimes people in directors also come.
Yes.
In previous years, when there were questions asked at estimates that needed to be answered, was your division ever called upon to answer questions?
Very rarely.
Very rarely, because no question pertained to your area?
That's correct.
Okay. And this time, question pertaining to your areas, you were not made aware of them?
If we were asked to provide information on questions of any sort, we provide that information.
Okay. Were you made aware that we had filed a request for freedom of access of information regarding the salary of Dr. Mazza?
No.
Okay. In the, when you supervise the budget of Orange, that is looking to make sure that there's coherence between what Orange is doing and what the budget document does this document ever talks about salaries?
No.
No? Were you surprised when you saw that the salary of Dr. Mazza was $1.4 million?
Of course.
In your view, do any of the other transfer payment agency in your division have salaries in the million?
I hope not.
Have you ever seen anybody else in a transfer payment agency being paid over $1 million?
I read about Ontario Hydro.
But within your division?
No.
No, it doesn't happen. All right. Would you say that you notice an improvement in air ambulance services after we went to after 2006, after we went to Orange?
I cannot honestly say I saw an improvement, but on the other hand, I did not see a deterioration.
Were there any indicators that you had to monitor to see if there was going to be an improvement?
There were many indicators, one of which was investigations, as we talked about previously, and a number of investigations in Orange, as I also said previously, did not deviate from a trend that we would expect to see. It did not deviate from that we saw in land ambulance service. It was totally normal until 2011, the latter part of 2011.
And it left France.
Okay. Right now, the former Minister of Health and the Minister of Health are laying the blame for what happened squarely in your division, that the bureaucrats did not do their work, did not flag things up to the ministry, which is why this scandal was allowed to continue for so many months, so many years. Do you agree with that?
I can only tell you that the staff at Emergency Health Services Branch, for which I am responsible, have acted totally appropriately and performed rigorously the oversight available to us and to them, including, as I said, the Ambulance Act provisions, the Performance Agreement provisions, and the Transfer Payment Accountability Directive.
So when Mr. Apps comes and says you did not have the competence to supervise this agency, do you agree with this?
I have no way of saying anything about Mr. Apps other than I can say to you that the people within the branch, Emergency Health Services Branch, are very capable. They are, in some instances, ex-paramedics. They have experience, in fact, air ambulance paramedics. They have financial expertise. I would tell you that they are totally capable of doing the job that is put before them.
Thank you very much. Thank you for your testimony today.
Thank you.
And our next witness will be Louis Bartolotta, Executive Vice President of AgustaWestland Philadelphia Corporation. Welcome. And you've received information on information for a witness testifying before the committee?
Yes, I have.
Okay, and I believe we have an oath to do.
So the Bible's in front of you there. So Mr. Bartolotta, do you solemnly swear that the evidence you shall give to this committee touching the subject on the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
And you have 5 minutes for a presentation, and then the three parties will have an opportunity to ask questions for 8 minutes each.
Thank you very much.
You're welcome.
Thank you, Mr. Chairman and members of the committee. As I was just introduced, I'm Lou Bartolotta, and on behalf of AgustaWestland, allow me to express our appreciation for allowing us to appear before you today. Our company history is one of hard work, ingenuity, focus on the customer, and through these elements, success. AgustaWestland is a world leader in the manufacture of turbine-powered helicopters, serving both commercial and military customers around the world. Today, over 4,500 AgustaWestland helicopters are in service in over 70 countries. 2,000 of them are serving in armed forces and military roles, and this includes the Royal Canadian Air Force's fleet of AgustaWestland Cormorant CH-149 search and rescue helicopters, whose 442 Squadron of Comox just won the SAR Award, the Search and Rescue Award for Operational Rescue Excellence at the 2012 Shepherd Search and Rescue Conference. Our congratulations go out to them. Another 2,500 of our helicopters are serving in commercial and public service roles, including aeromedical, offshore oil support, general utility, and police and municipal agency applications. More than 300 of our helicopters serve in the aeromedical field. And today, over 80 AW139s serve in aeromedical and search and rescue roles in 16 different countries. Ontario's healthcare system and the role Orange plays in it are held in high esteem. So I think you can imagine how proud we were in August of 2007 to be among those manufacturers to receive a request for information from Orange in its bid to replace its aging helicopter fleet. And we were even prouder in March of 2008, after a rigorous selection process and a demanding contract negotiation phase, to be awarded the contract by Orange to provide the next generation of modern helicopters to serve the citizens of Ontario for the next 25 years and more. That process and that contract brought out the best in our company. The operational, delivery, and certification demands defined by the Orange team caused us to organize our internal resources even more effectively than before and to work seamlessly with external organizations such as Transport Canada and the FAA of the United States to achieve the contractual obligations, including certification of the 139's full ice protection system. This optional system, which allows the helicopter to operate in known icing conditions, is a first for an aircraft of this size. It was a wonderful challenge that faced us, and one we were certain we would successfully meet, which we did. We already had a winning aircraft in the AW139. Starting before its first customer delivery in 2004, the 139 had been met with unprecedented acceptance by the world's commercial, public service, and military operators, capable of carrying greater payloads, greater distances, in instrument and visual and VFR conditions over its competitors. The 139 really is one of the great success stories of our company. As testimony to that success, we'll be delivering our 500th AW139 at the Farnborough Air Show this summer. And we expect the fleet operational hour level to reach or exceed the 500,000 flight hour level by that time. So with this selection of the 139, the citizens of Ontario are being provided with the best helicopter available to serve their aeromedical transportation needs. And they're joining other prestigious Canadian operators of the 139, including Shock Trauma Air Rescue Service of Alberta, and by the way, in 2013, they're moving into Saskatchewan as well, and London Air Services of London Drugs. When AgustaWestland was given this opportunity to work with the province of Ontario, with the Orange Air Ambulance model, and with the 139, it was clear to us that this was a winning combination a wonderful brand, and something well worth working together on to export beyond Ontario, both inside and outside of Canada. Many countries today are eager to take a proven model such as yours and put something like it to work for their own citizens. And that concept is in line with one of our core values. Whenever possible, we believe in working in partnership with our customers and in supporting mutually constructive endeavors. For example, when AgustaWestland
Minute left for your opening statement.
For example, when AgustaWestland was asked to contribute to the Orange Foundation, we did so willingly. The same goes for the 2010 announcement of the Orange AgustaWestland Endowment Fund for Aboriginal Learners, based in Thunder Bay and provided through Confederation College to encourage Aboriginal students to pursue careers as paramedics and pilots. These examples are no more than what we have done in the past with other programs we believe in. In closing, yes, we are very proud of our affiliation with Orange Air Ambulance, the Ministry of Health, with the province of Ontario, and with our service to the citizens that they represent. We're grateful to be playing our part. Thank you.
And thank you for that. And the official opposition goes first in this round of questioning. Mr. Klees.
Thank you, Chair. Thank you, Mr. Bartolotta, for being here. Could you tell me about FinMechanica? How is that company related to Augusta?
How is FinMechanica related to Augusta?
Yes.
FinMechanica is the shareholder of AgustaWestland. It's a very large consortium of companies in the Italian industry. It's, I believe, the second largest industrial conglomerate in Italy.
So is it appropriate to characterize it essentially as the holding company of Augusta?
It's the main shareholder of AgustaWestland.
Who is Pier Francesco Gargalini?
Guardaglini?
Yes.
He was the past chairman of FinMechanica.
And where is he now?
I suppose in Italy, I don't know.
What was his position with FinMechanica?
I believe he was chairman.
And why did he resign?
I don't know.
You don't know?
Well, if you're alluding to the reports in the press, he resigned his position back in, I'm not even sure it was 6 months ago, 8 months ago.
Mr. Bartolotta, we all have access to information. It would be helpful, and I think in your best interest, if you just were forthright and told us why you resigned.
I think I just told you that I really don't have information to that. I couldn't add anything you might have read in the press.
Okay, well, I understand there were 4 investigations. Prosecutors exposed a system of patronage, slush funds, and bribery and kickbacks at this company, and that because of that, the chairman resigned. Does that help you remember?
Sir, you're talking about reports in the press, and I can only tell you I have no more knowledge of what went on at FinMechanica at that level than you do. I
find that very hard to believe.
Well, I'm sorry.
However, it's your testimony under oath, and we'll see where this takes us. Do you know the name Lorenzo Borgogni? Lorenzo Borgogni?
No, sir, I do not.
He was FinMechanica's Director of External Relations, who also resigned after a flurry of media reports that he was being investigated in a slush funds case that involved bribery of politicians, kickbacks of deals. You know nothing about this?
No, sir, I don't. You have to understand, AgustaWestland is one of many companies within FinMechanica. You're speaking about a holding company that resides in Italy. I don't have direct information any more than you do.
Well, the reason that I thought it was important that we have this discussion is because you're well aware that the Auditor General's report makes reference to a very interesting payment by AgustaWestland to Orange, some $6.7 million. Very, very interestingly, a short period of time after a multi-million-dollar purchase was made from Augusta. Those of us who have some knowledge of how business works immediately looked at that payment and the flags went up. Sounds like a kickback to many of us. How would you characterize it?
I find your insinuation and allegation insulting to me professionally, to my company, and I have nothing further to say towards your statement.
What was the $6.7 million paid to Orange for?
I'm not sure.
What did you get in exchange for $6.7 million?
Perhaps you'd like to tell me what $6.7 million we're speaking about.
Auditor General?
We mentioned $4.8 million relating to, I think it was providing some marketing assistance. I'm not sure about the 6.7. Maybe there was another $2 million. We did mention there was a 4.8 marketing agreement, I think. Does that ring a bell?
Yes, sir.
Yeah.
Marketing services agreement, yes, sir.
And what did you get for that? What did Orange do for it?
Two things are important to understand about the Orange program. One is the value for money that the citizens of Ontario have received in the purchase of these aircraft. There is no finer aircraft available today to provide the service of the citizens of Ontario. Distinctly different from that, you have, as I mentioned in my opening statement, a remarkable organization in Orange. The depth of knowledge, of medical skills, of operational protocols are world-class.
Really?
Yes, sir.
Sir,
Really.
you have not been
May
in touch.
I finish?
You have not been in touch with Ontario.
Mr. Cleese, please let him finish.
Thank you. The marketing services agreement that we have with Orange, which was at $4.77 million, was a strict contract with services relationship. They are responsible for providing to us a series of reports, which they've done to a degree before all of this, unfortunately, blew up, to help us better understand where in the world there would be similar models that might be helpful for us to pursue. I'm speaking more generally, but where countries might have a requirement for air medical transportation, where the Orange model might fit, and we felt that their expertise was superior to anything else we could find in the marketplace, so we have a contract with them to provide those services and those reports.
And you have a minute and a half.
Okay. The rigorous RFP process to which you referred, I understand took about 30 days from the time that the RFP went out to the time that it was closed. Do you consider that rigorous?
Yes, sir.
Really?
Yes, sir.
It's incomparable to any other RFP process that I have come across. There isn't anyone in the industry who considers that rigorous. And I have to say, sir, that you don't leave me with a good feeling about the relationship between Orange, the people who were involved in transacting the deals. We will have many more questions for you.
I appreciate that.
Thank you. And the NDP, who would like to ask questions? Mr. Singh.
Thank you very much. Good afternoon, sir. So just to follow up with just some questions on those services provided. So do I understand it correctly? It's $4.77 million.
Yes, sir.
In exchange for reports that were provided from Orange to AgustaWestland.
Yes.
And the nature of these reports, can you just clarify that?
The nature was basically a sequence of identifying what they saw as areas of the world where a model such as Orange's would be appropriate to pursue. Prioritization of opportunities is the best way to put it.
Sure. And how many reports were received?
Two.
Two reports?
Yes, sir.
And how long were these reports?
How long were they?
In length, in terms of...
I don't know specifically, but let me take I believe the first phase one, may have had 80 pages to it.
Okay. And how far in between were they provided?
They are sequential. They were to run from day 1 through 180, 181, 6-month periods.
6-month periods?
Yes.
And the agreement, how long was that agreement for?
It was for 500 and whatever, 180 times, 540 days.
540 days?
Yes.
And so the 4.77 million reflects 540 days in which they would provide reports at 6-month intervals?
Yes, sir.
Okay. Was there any, at any point in time, did AgustaWestland or any representatives meet with Mr. Mazza directly?
Certainly.
And in those meetings, was there ever any elected representatives present?
No, sir, not that I recall.
Okay. And those meetings were conducted in all the meetings involving the purchase of the helicopters, were they all conducted in Ontario or any conducted?
No, sir. They were held in Philadelphia, where we have obviously our North American facility. We have 535 employees and producing 2 lines of aircraft, including the 139. They were held here in Toronto, and they were held in Italy as well.
Okay, thank you.
Thank you. You'll understand by the line of questioning, the reason you're here today is because I put your name on the list. And the reason I put your name on the list of witness is because of what the auditor is just talking about. The fact that the Ontario government, I'm an elected official, and the Ontario government has given Orange millions of dollars to purchase helicopter. Then we see that Orange gets a contract from you. We have made a purchase, we as in taxpayers' dollars of Ontario, has made a significant purchase with your company, then you turn around and purchase services from us.
Sure.
I thought we were done with those things.
Well, wait a second, you haven't heard what I'm going to say, okay? Sure. I'd like to move in camera for a couple of minutes before we continue on this.
Okay, we will go in camera for a few minutes. If we can halt your testimony, please, and we will go in camera.
I go back here?
You leave the room at this point, please. Now with the questioning of the third party, and Ms. Jelinek is going to restate whatever the question she was last answering. She has about 5.5 minutes left to ask you questions.
So, sorry about this little interlude there. But, so we all got to decide who we wanted to call. I picked you. And the reason I did that was because when I read the Auditor's General report, we can see the amount of money, taxpayers' money, that has been paid to your company, to Augusta. And then we see Augusta buying services from the same entity that had bought services from you. The optic of it looks suspicious.
Yes, ma'am.
Was there anyone within Orange, when you went and wanted to purchase services at Orange, did any of them raise concern that the optic would look bad, given that they were a government-funded agency?
No, ma'am.
They never did.
No, ma'am.
at your end?
Well, neither did we see it as something that would be viewed as such. It was a very honest, straightforward contract for services.
Okay. Are you aware of the corporate structure of Orange?
Not intimately.
Okay. Do you know that there are a part of Orange that is a not-for-profit agency, that are some other parts of Orange that are for-profit agencies?
I'm learning as we go, yes, that there
You're
is a
learning as
variety of structures within Orange.
Okay. When you purchase those services from Orange, do you know which Orange company you purchased them from?
Orange, to us, the perception or the optic, to use your word, of Orange to us was it was orange and then orange peel and then different names, and BNY, I think, came out of it. We had received notification from Orange that they were establishing certain companies, not that they were for-profit or not-for-profit, just that they were incorporated under the laws of Ontario. So it didn't really, not that I say it didn't matter to us, we were confident that whatever was being structured was proper, and that the same people we were dealing with the one entity were in the entities that were being created, so it didn't really cause too much concern.
So did you know who you were, which one of those entities you were purchasing services from?
Yes, it was, yes.
And do you remember the names?
It was Orange Peel, I believe, was the one with the marketing services agreement.
Okay, so the marketing services agreement was signed with Orange Peel, but the same people you had been dealing with for the purchase of, were the same people that you were now purchasing services from?
Well, the officers, the people signing the contracts were Dr. Mazza, Maria Renzella. I believe Tom Lapine was on some of the documents. It was familiar faces, let's put it that way.
And they were the familiar faces that...
People we knew.
Okay. You know that Orange has been dismantled, that Mr. Mazza is gone, that the entire board has been fired and a new board has been put into place. Did you know that they are under investigation right now?
I understand the board resigned and voluntarily resigned, and of course I understand that's why we're here. They're under investigation.
Okay. I just wanted to make sure. So you saw no red flags when a company that you had just done business with, you go back and do business with them. Is this something that you've done in other parts of the
Yes,
world,
ma'am.
in other transactions?
Yes, ma'am.
Okay.
Absolutely.
Okay, because we have, we read the papers just like everybody else. I'm reading the unraveling of Belgium kickback scandals in which your company is named all over the paper. And it looks very much like what happened in Ontario, where a purchase was done with your company and then a return purchase is then done with your company purchase services from executive in the Belgian government. Do the two transactions look alike to you?
Ma'am, I don't believe I was...
You know, that is just patently unfair question. Take some situation...
You don't have the floor. You don't have the floor.
Do you know anything about the transaction that happened in Belgium from Augusta?
Do I know anything about the transaction? Ma'am, I don't think I was even with Augusta when the sale of the aircraft to Belgium took place. I'm not sure. It goes back quite a few years we're talking about.
Okay.
And you have 30 seconds left.
Okay. So we have an issue here in Ontario where our Auditor General has told us that the people of Ontario have not gotten value for the money that the taxpayers have invested. Some of that money has gone to your company, and some of that money have gone from your company back to holdings of Orange. If there is anything you can share with us as to who you paid that money to and the type of report that you got, if there was a request for proposal or sharing the contract, anything that would put that piece of the puzzle at ease, I would encourage you to do this, because right now the optic in Ontario are not good. The people that were at Orange, the people that you were used to dealing with, are also having a tough time. Anything you can do to show us that this was a legitimate transaction, you got
Certainly.
4.77 valued of money
Yes, ma'am.
for the services provided, please share that with us, because right now the optics
Can I
are-
take that back with me and review and get back to you on that?
Yes, you may.
Thank you.
It's time for the government to ask
Thank
questions.
you.
Go ahead, Ms. Sandals?
Yes, and as Madame Jeanne pointed out, her party had asked for somebody from AgustaWestland to be called, and I think it was actually your company's choice
Yes,
that
ma'am.
you would
It
appear
was.
as the witness, Mr.
Yes, ma'am.
Bartolotta. So I wonder if you could explain to us what your direct involvement was, because we got the impression it was because you were the person who was directly involved.
Yes, ma'am. I'm Executive Vice President with the company, and I was the lead in the negotiations with Orange.
And it would be, your name would be one of the names that would
I'm
appear
sorry?
on, your name would appear on contracts?
Yes, ma'am.
Okay. So you were directly responsible then for the
Yes.
negotiations. One of the things that comes up in the Auditor General's report, which I think has received some attention from a lot of us, is the fact that there were 12 helicopters purchased. There are various numbers that float around as to the number that were actually required, but they tend to range, I think, more in the range of 6 to 10 absolutely maximum were required, and it's clear that 12 were purchased. So did that come up at the time in the negotiations, that an explanation as to why there were more helicopters being ordered than were actually required?
Ma'am, as a supplier of aircraft, it's not up to us to address that situation with the customers. The customer's decision about how many aircraft they're going to buy for their needs. And then we do our best to respond to the request. By the way, the contract was for 10 with 2 options. And then the 2 options were exercised within the option period of the contract.
So in fact, there were
Yes,
ultimately
but
a
it was
total
10
of
plus
12,
2.
but it was 10
Then it was
plus
12.
2
Yes, ma'am.
options, which may be why the numbers that are reported don't always quite add up. Depending on when the helicopter leaves Augusta, is it a shell, or have you already done any of the interior configuration? Because some of these helicopters, I mean, obviously the bulk of them ultimately ended up being air ambulance configuration. But some of these helicopters ended up being a passenger configuration. When they leave Augusta, are they a shell, or do you know which way they're headed?
Well, generally speaking, a customer can take, any customer I'm speaking of, can take a variety of configurations that delivery. It can be what we would call green, with very little done to the aircraft except the basic fabrication of it. It can have some additional avionics put into it. It can be painted, not painted. It can have an interior that we're supplying. So there's a whole wide variety of configurations.
So in the respect of the
Specific-
12 that were ordered by Orange, how were they delivered in terms of configuration?
Orange had everything done by us to the aircraft except the interior. The medical interior was a separate contract that they took care of, independently of us, except for whenever a customer does this, and it's not unusual for a customer to go to a third party for an interior, we have to make certain that the two marry up for the plumbing, if you like, for the electrical and other components of the aircraft to marry up to the vendor supplying the interior. So with Orange, I believe it was 10 aircraft went ready to receive their medical interior. And during the delivery process of I don't know where we were in the process of what number aircraft, Orange asked us to take the last two and put them into another configuration, which was more or less a standard configuration, a utility configuration.
And that would be the last two
Yes,
that
ma'am.
were the
11 and 12.
option to 11 and 12.
Yes.
Where left you ready to be used as passenger or...
Well, they were not
something.
aerometically configured. They were
weren't
standard seating.
configured. So what would be particular about the ones that left, the first 10 which left configured? Are you saying that the wiring is different or lighting or whatever?
Well, they're ready to receive, how can I use an analogy? Take a house, and you're having somebody come in and put a new kitchen in with a lot of plumbing. You've got electrical and water and waste. To receive that, you have to put certain things into the basic house. And then the person finishing it is going to come in and fit to finish. That's what we're talking about. So when we delivered to Orange, they were painted, avionics, well, I'm not sure what, we did have additional avionics installed, and it was ready to go to the completion house.
Okay.
Okay? And then
Okay.
from there, so we delivered to Orange, and then from there, Orange had a contract with a third party, and they took the aircraft home.
Okay. Can we talk a little bit more about, because you've been asked considerably about the contracts, but about the charitable contributions. And I understand that large corporations often make charitable contributions, but is that, like, how do you arrive at the decision-making? What decision-making went into deciding a $2.9 million contribution to the charitable foundation? Because, like, that's almost $3 million.
Yes,
That's
ma'am.
pretty,
Oh, we
even for a
understand.
big company, that's a
understand.
big contribution.
Yes.
So how did you go about deciding to make this really big contribution to a charitable foundation that was, to put it mildly, not a very well-established charitable foundation?
Well, it was after the contract, sometime after the contract had been signed, we were approached by Orange, by Dr. Mazza, to
So this was
consider...
post-signing
yes, ma'am.
of the contract?
Yes, ma'am, well after. He explained the foundation. By the way, when we talk about this piece of, this size of money, of $2.9 million, obviously it goes upstream. And we have a lot of people that are cognizant of what's going on and involved in any decision like this. But basically, the foundation's purpose was explained to us, and in raising the awareness of Ontarians to Orange and to help people contribute to the foundation, which is, I guess, the best way to express the description of the foundation by Orange to us. We felt that the program itself is something we believed in.
So how did they describe the program? Because I think that's
The
something
foundation?
that, yeah, the foundation, because I think that's something that in fact is quite unclear to the Ontario public, is what was the foundation actually supposed to be doing.
As I recall, the foundation, its purpose is to raise the awareness of Ontarians to Orange, and to solicit more people to fund the foundation, so it gains some, I guess, some fiscal strength. But it was really the raising the awareness of the Ontarian that we were interested in. If it was something that hadn't been done in the past and it needed to be done, and we felt it was appropriate that we would support something like that, we, as I said before, willingly supported contributing to it. It is a large sum of money, but we thought it was well worthwhile.
So,
And you have a minute left.
so did you think of this in terms of something like a hospital foundation, where you know that when you contribute to a hospital foundation, they use it to buy more beds, more equipment?
Yes, ma'am.
So what did you think when you found out it was used to purchase really expensive motorcycles?
That's not exactly the way.
That's not
No.
Well, explain
Okay.
that.
The way the foundation had a number of different, let's say, opportunities they wanted to pursue with using the foundation's money to just do that, raise the awareness of Orange, of the Ontarians with Orange. One of them was the, I don't watch the show very often, but it's Orange County Choppers. And there's a lot of synergy, Orange of Syracuse. Chopper. The actual amount of money that went to that, I think most of that went to the production of the television show. They only have 12 of those shows per year of all the motorcycles they make, and I think they probably make one a week or two a week or whatever it is. The production of the television episode is where most of the money went to. And the motorcycles were, I think, I'm going to take a guess and say they're 50,000 or 40,000 apiece, something like that.
Thank you.
It was about that.
We are out of time, and thank you very much for taking the time to come before the committee today. Appreciate it. And our next presenter is Trevor Harness, former aviation training officer with the MATC Ministry of Health. So welcome, Mr. Harness. And you've read the information for a witness testifying before the committee?
Yes, sir.
Okay, very good. And our clerk will do an oath.
Mr. Harness, do you solemnly swear that the evidence you shall give to the committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
You have 5 minutes for an opening statement, and then the parties will ask questions.
Thank you. Mr. Chair, members of the committee, thank you for inviting me here today. I am a former member of the Ministry of Health's Air Ambulance Medical Air Transport Center in Orange. In my 11 years working at Air Ambulance, I served as both a fixed-wing and helicopter flight controller, aviation trainer, and member of OPSU's local executive. I am a former police officer and certified police dispatcher, both a fixed-wing and a helicopter pilot. I have also got an extensive background in customer service, operational management, and business operations, including setting up 3 communication centers. As someone who was dedicated to my job, I was one of the many employees who were fired from Air Ambulance for attempting to stand up for patients and taxpayers during the creation of Orange. I took incredible pride in my job, and I'm thoroughly disgusted at what has been allowed to happen to our air ambulance services in Ontario. It is a disgrace and an absolute abuse of taxpayers' money, and more importantly, their trust. Part of my role here today is to give a voice to current and former employees, people that are and were dedicated to providing the highest, most professional level of air ambulance services to the citizens of this province, many of whom were bullied, harassed, ignored, and terminated. Although attempts were made to warn the minister of this growing crisis, they were all ignored by the Ministry of Health, the Emergency Health Services Branch, and even the Auditor General's Office. With nowhere else to turn, we collectively made a decision that was in the best interest of taxpayers and patients. When the ministry chose to look the other way and failed to live up to their responsibilities, our team was put into action. The creation of Orange and the subsequent for-profit entities have jeopardized the health care of citizens across this province. A monopoly by design, the cost of Orange affects not only the public, but numerous stakeholders, including hospitals, nursing stations, private aviation providers, and hundreds of employees. People lost their jobs, people lost their lives, companies were forced out of business. Taxpayers' money was squandered with no care or concern, all the while vital aircraft sat on the ground with the excuse that the organization didn't have enough funding. Orange was an experiment gone very wrong, an experiment whose responsibility lies solely with the Minister of Health, the Ministry of Health, and the Emergency Health Services Branch. As far back as 2006, attempts were made to alert them to problems developing with the creation of Orange. Not one person followed up on credible leads and factual information. They chose to ignore the warning signs and failed to perform any due diligence. All senior management and members of the various boards of directors are equally responsible and culpable for the destruction of air ambulance services in Ontario. Greed was the guiding principle in their decisions that benefited a select group who had no conscience about making a profit on the backs of sick and injured patients requiring emergency air transport. Even more disturbing is decisions surrounding safety and service provision that were being made by unqualified individuals who were solely recruited for their ability to agree with management. The organization itself was built on a culture of fear, intimidation, and harassment. Anyone who questioned any decision, policy, or procedure was dealt with swiftly, from immediate dismissal to threats of legal prosecution. Many hardworking, responsible, and dedicated employees found themselves forced out of a job they were committed to, and no one would listen at the Ministry of Health, whose job it was to oversee this vital emergency service. Nowhere else are the consequences more evident than in the communications center, the heart of air ambulance operations. From here, emergency calls are received and life-saving flights are planned. Seconds count.
Having the right people, the right equipment, and qualified, experienced leadership means the difference between life and death. Yet again, the Minister of Health compromised one of the most essential components of air ambulance operations. Today, the reputation of Ornge is one of failure, mistrust, and scandal. A once proud and efficient organization is now an international disgrace. The credibility has been lost and the damage has been done. The problem is the business model itself. Simply changing the performance agreement or proposing new legislation is not the answer, nor is bringing in expensive consultants with absolutely no experience in Ontario's air ambulance program. Ornge is broken and cannot be fixed. Air ambulance is not a business, it is an emergency service and needs to be run like one. It requires specialized skill and experience. In this business, seconds count. Today, there are still individuals at the organization who are actively involved in the design and subsequent demise of the air ambulance program. These individuals were architects of the culture leading to this catastrophe, individuals that have proven repeatedly that they have no idea what they're doing, yet are still being grossly rewarded for their incompetence. The public, employees, and stakeholders have all lost faith in the Ministry of Health. Contrary to what the Minister may state, there is no confidence in the organization by frontline staff. They are frustrated, tired, and mentally exhausted at the absence of qualified leadership and real change. Respectfully, the Minister of Health and her staff are completely out of touch with the reality and the magnitude of this emergency. To use appropriate terminology, air ambulance is in critical condition. Under the current structure and leadership, a once proud and reliable emergency service is now on a course to collapse. It is a rudderless ship that is destined for failure. Left to continue down this path, air ambulance services will not only get worse, the liabilities will continue to grow. For too long, inaction has led to tragedy. You didn't listen to us before, please listen to us now. Lives depend on it. Thank you once again for the opportunity to present to the committee, and I'd be very happy to answer any questions.
Thank you, Mr. Harness. The NDP will go first this time. Who would like to ask questions? Mr. Singh?
Yes, thank you. Mr. Mackey, thank you very much for coming here today, and thank you very much for that introductory
Mr.
comments. Pardon?
Mr. Harness.
My apologies, Mr. Harness. Sorry, my notes are mixed up. Sir, could you just outline, you indicated that you had notified people before about some of the problems. Can you just explain who you notified and what the problems were that you highlighted?
Yes, on April the 5th, 2008,
Yes?
I was contacted by my manager at Ornge at the time, and had already done the transition over, regarding a call where a child had died. A child had died in the hospital, and our move of the patient to the hospital was done without incident. But it was one of the natural processes where they were doing an inquest. During that statement, the Minister of Health Investigations, a woman by the name of Wendy Kerrigan, was conducting the interview. Having been a police officer, I was aware of my rights and the process, and I was opposed to having members of the management team invite themselves to be part of this interview. It was done on tape, and at the end of it, Ms. Kerrigan asked me if I had anything that I wanted to share. And I told her in front of the management that I did, but that I wanted to talk to her in private regarding some incidents. The manager at the time asked to see me out in the hall, the head of investigations. I apologize, I forgot her last name, Deborah. She, a former police officer, works as one of the investigators with Ornge. She demanded to know what I was going to tell them. And I reminded her again of both her background as a police officer and mine, and that she was in a position of obstructing justice at this point. She subsequently stopped persisting to want to know what I was going to tell her. Ms. Kerrigan was then hassled, for lack of better terms, by Sandra Wilkie, who was the manager of the comm center at the time, and they wouldn't allow me to talk to her. I subsequently went back to my operational desk. Within 30 minutes, I was called to one meeting, and we were incredibly busy. We were short-staffed. I had a suspicion what they were up to, and I was allowed to return to my desk, only to be recalled this time to go with the head of operations, Al Stevens, up to meet Rhoda Beecher, who was the VP of Human Resources. Again, I asked her what this was about. We ended up in a boardroom with Chris Mazza, and he had nothing shy of a temper tantrum because I refused to tell him what I was going to tell the Ministry of Health. And he advised me that he was going to grab the tape and he was going to find out, and his words were that nothing goes outside this house. I persisted in holding my ground. He had a shouting match and walked out of the room and never came back. Within an hour of that, I was suspended, and I cautioned everybody along the way, from the VP of HR to the manager of HR, that what they were doing was not only against our collective agreement, it was against the Employment Standards Act, and it was against the Human Rights Code. And I was sent home without, I asked them why they were suspending me. They insisted they weren't suspending me, and I was subsequently fired within 48 hours.
Wow, okay. Could you just highlight some of the problems that were occurring in Orange? Just if you could give me a list of some of the main problems.
They're endless. From the starting of operations, the Orange is, and is continuing on down the path of having incompetent individuals running that organization. People with no qualifications whatsoever, people that have no qualifications in air ambulance. The systems that they're using, computer systems, are not conducive to air ambulance operations. In this business, as you can appreciate, we don't have the luxury of pulling off to the nearest cloud to figure out things. We have to make decisions very quickly or people are going to die. The computer systems are part of the problem. The quality assurance is a huge problem. They have an individual who is in quality assurance and has no idea what she's doing whatsoever, and she's been doing that job for 2 years, yet the Auditor General's report identifies 12 separate areas where they couldn't even track something as simple as the number of ground ambulance transfers they did.
Okay. With respect to your correspondence, you said you tried to communicate some of these issues with the Minister of Health.
Yes, I did.
How did you do that, and when did you do it?
Starting on the April the 6th, I made several phone calls to the Ministry of Health trying to get through. I did that for approximately 3 days. I was in touch with OPSU, which was our union at the time. I could not get any answers from anybody, any headway whatsoever. At one point, OPSU was going to, they had contacted their legal department to actually bring Orange in front of a courtroom because this had been happening on numerous occasions and they wanted to actually finally get this out in front. After that, I contacted the Auditor General's office and spoke to one individual on 2 separate occasions. And because, as you can appreciate the nature of this, I was served with legal papers threatening to sue me if I spoke about anything. I was advised by the Toronto Star that I was one of 8 employees that were followed by private investigators hired by Orange. So you can imagine the atmosphere of trying to get information across. When we finally realized that we were getting nowhere, no one was going to listen, we turned to several media outlets, and that's when we started essentially our own investigation.
So this is April 6, 2008, am I
Correct.
correct? Did you ever send any correspondences, like a letter or email to the Minister of Health saying, listen, Orange has got some serious problems, anything of that nature?
I sent my suspension notice, which is 5 pages long,
Yes.
to the Ministry of Health and never got a reply.
Okay. Okay, thank you.
Just to keep on your train of thought, you outlined a number of deficiencies within Orange. Were you aware, in your view, did the corporate structures that was put in place of having the not-for-profit and having other, did that help patient care in any way, shape, or form?
Absolutely not. I spent the last year and a half investigating Orange and their structure, and our team had tracked approximately 14 for-profit companies right from scratch, and this, believe it or not, is right off of Google. We use media sources. The for-profit companies were there for one reason and one reason only. They were there to line the pockets of the same individuals that put themselves on all of the for-profit boards. The Orange non-profit, the actual air ambulance operations, were put at jeopardy, for lack of better terms, by the interests, which included sourcing out business. We investigated down as far as Miami, Florida. And so the efforts that should have been put into the actual air ambulance taxpayer-funded operations of providing helicopters and airplanes was basically a distraction for the management. They were more concerned with figuring out ways to make money, to get shares, to get bonuses, versus the fact that your helicopters are not staffed with appropriate paramedics. You have aircraft sitting on the ground. At one point, there was a Thunder Bay helicopter that sat on the ground for 5 days in a row because they said they didn't have funding to staff the aircraft.
And you have a minute left.
When you say the same people that were all, would you name those people?
Well, the first one comes to list is Rainer Belzer. If you look at, he is the chair of, or was the chair of Orange Nonprofit, also of the Orange Foundation and of J. Smarts. His name appeared on the top of the list of every single for-profit company. Chris Mazza's name also appeared on the majority of them, with the exception of one. And even Alfred App's name appeared on a holding company.
I'm just going to ask one quick question. Can you also add, you said there's some people who are involved in the design and the destruction that are still involved now. Can you name those
Yes.
people as well?
There are numerous. There are literally every base manager. Steve Farquhar, who was Tom Lapine, the former VP of Operations, #1 man on the job. These were people that designed the policies and the procedures that were put into place. Sandra Wilkie, who apparently was in charge of quality assurance for 2 years, and as the auditor pointed out, there's major deficiencies. And these people are all making in excess of $120,000 a year, plus bonuses.
Thank you very much. It's now time for the government. Mr. Zimmer?
You used the expression, we investigated Orange, and we investigated them. Your investigation went on for a year. You made some reference to investigating something, or a trip to
Yes, sir.
Miami or something. How many people were on your investigative team?
On a reserve side, 28.
And can I have their names?
That, unfortunately, you cannot.
Why not?
Because as with any intelligence investigation, part of that is anonymity, and we
Okay.
have to respect that.
All right.
These are, just so you know, most of these people are still currently working either as paramedics or in the communications center.
Who's the lead investigator? Is that you?
I would say yes, that would be myself.
Okay. Can you give me some of the names on the investigative team?
The only names that I can tell you would be Kevin Donovan of the Toronto Star, Paul Bliss of CTV, and believe it or not, they have no idea that they are part of the team. They have been contacted over the last year and a half under different aliases.
Sorry, I just want to understand this. So Kevin
Donovan is the reporter for the Toronto Star.
and Bliss, what's his name?
Paul Bliss from CTV did
And
coverage
they're on
it.
your investigative team, but they don't know they're on your investigative team.
Exactly. They've been spoken to under different aliases.
Well, would they be surprised to know that they were on your investigative team?
No, not at all.
Well, then why don't you tell them that they're on your investigative team?
In regards to if you're going to have an investigations where intelligence comes in, you're relying on a lot of trust of a lot of people with information.
How can someone be on a team, whether it's an investigative team or a baseball team or any kind of a team, without knowing it?
Well, this
How
isn't a
does that
baseball
work?
team. This is an investigation
All right.
into corruption. And when you're dealing with these kind of investigations, you have to do what we commonly term as undercover work.
Okay.
I operate under 3 different alias of names. People have no idea they've spoken to me in the past.
Can you tell me what your alias names are?
That I cannot.
Can you, thank you.
Ms. Sandos?
Okay, now my head is splitting. So this is an undercover intelligence team, and I think you said 28 members, but you meant the 2 that you named didn't know that they're part of the team. How many of those other 28 members know they're part of the team or don't know they're part of the team?
99% of them know they're part of the team. The only reason those 2 don't, as you can appreciate, is that because we're dealing with contacting people right up as high as vice presidents of companies, we can't simply say, well, this is what we're going to do. We want to put it on the 6 o'clock news tonight. For example, the situation with CPR in the aircraft where they couldn't do CPR, those photographs were provided through the team by paramedics that are working still, and as you can appreciate, they are in fear for their jobs if they're ever discovered.
So you mentioned that you've taken trips to various places to do this undercover investigation. So this is quite a large undercover investigation you're describing here. Who would be funding this undercover investigation?
Believe it or not, nobody. There's not a single person, including myself, that got paid a dime.
And how did you, what are the qualifications of your undercover investigators?
When you talk about undercover investigators, you're talking about, it comes down to one essential word, and that is trust. If they trust me with the information that I'm not going to reveal their identity, that I'm not going to pass on their ISP address with an email, they're going to provide you with accurate information. The second you violate that trust, you will not get that source, very much like in policing. You will not get that source, that information you're looking for. So it's taken us a lot of time to build up the trust of employees, both current and former, members of various corporations, to give us information that we can connect the dots so that we can put this information forward, which you have read about in the newspapers on no doubt on several occasions.
So are you claiming then that you're the source of all the information that has been in the media?
No, I would say that I'm one of probably...
Like, or your team is the source?
Not the entire source. I certainly don't want to take anything away from Kevin Donovan. He had an entire team of reporters working on it, and they did a lot of their own investigations as well.
Okay. Mr. Zimmer has a question, and then if we have some time, I have some more.
You're not prepared to share the names of your investigative team with this committee. Would you be prepared to share that information with, say, the ongoing OPP investigation?
If they asked me, I would certainly quantify those, and they would appreciate that there is a privilege there with informants, and if we can provide any information, certainly.
Thank you.
I thought we had an agreement around this table regarding this issue, and Mr. Zimmer raised it a number of times himself now, puts his foot in it.
Yes,
It's a process, no substantive. I just asked if you'd share the information.
Chair?
Are you finished,
I'm
Mr.
done,
Zimmer?
thank
Okay, Ms. Sandals.
Okay. I guess, given Mr. Klees' role in all this, is he knowingly or unknowingly on your team?
Mr. Klees was one of the first individuals that I spoke to about a year and a half ago, and forwarded a lot of the information to him. And as we did attempt to make contact with several other MPPs. And I've even tried at one point getting in touch with the Minister of Health herself. Couldn't get a response back on a couple of different occasions. They wouldn't even let us get past. I asked to speak to her assistant. I said, I understand you're not going to put me right through to the Minister of Health, but let me qualify what I have to say, because our intent has and is and has always been by the team to fix this mess. Nobody is getting any compensation. Nobody's getting any perks from anybody. Everyone here truly has a dedication for patient care. We've lived our lives to it.
When you talked about you were Googling people, so in trying to prepare for today, I Googled you, and I came up with something called Regional Air Support and Rescue, RASAR, and your name came up as associated with that. Could you explain to us what that is?
Yes, that's a charity that I set up as a helicopter pilot to...
So this is a charitable nonprofit helicopter business?
It's not a business, it's a charity. It's a registered charity.
And what does this charitable helicopter business do?
Well, what we're in the proceeds of doing is we have a fundraiser that is going this October, and our foundation is set to purchase a small helicopter that is going to be made available to emergency services in the GTA, that in the event of a child goes missing or a patient wanders away from a medical facility, we would provide the aircraft and two of us pilots free of charge to that municipality.
So you don't actually have a helicopter?
No, I fly through another base.
And so this thing exists on the website, but it doesn't actually provide any, because it says it's air support and rescue. So at this point, it's a name, and you're trying to raise money.
That's correct, yeah.
but it doesn't actually provide any service. even though
Not as of yet, no.
So you're collecting money and getting as a charity, but you're not actually providing any service?
No, that's incorrect. We're not collecting any money right now, as I said earlier. In October of this year, we have a major fundraiser that's going to generate about $600,000 net, and that money in October will be used to purchase the aircraft.
Thank you very much, and now we'll move to the official opposition. Mr. Klees?
Thank you, Mr. Chair. Mr. Harness, I want to thank you for, first of all, being here and for all of the work that you have done. Through you, I want to thank the other frontline people, pilots and paramedics who have had the courage to come forward and provide us with information. Without that, we wouldn't be here today. And so I just want to thank you for that.
Thank you.
I also want to make it very clear that the objective that we have here in this committee is, first of all, to review the Auditor General's report. And it's the Auditor General's report that confirmed many of the things that you brought to our attention. Apart from the financial irregularities, which we're not going to get into here because there is a criminal investigation into those, what is particularly concerning to us are the operational issues, some of which you referred to. The Auditor General in his report indicated that there are some 20 incidents that were reported back to the Board of Orange, and a number of those involve patient deaths. And I think, as I hear you, as a professional, what motivates you and has motivated you is precisely that, that we now have an air ambulance service that is dysfunctional at best. And my question to you is, you have heard the Minister of Health boast about a new CEO, a new board of directors, a new performance agreement, and that all will be well. I'd like to know from you, based on your knowledge of what is actually happening on the front line at Orange, how encouraged should we be that we're on the right track here?
Not at all. Orange is a model, as I mentioned earlier, that is broken. I am very familiar with the structure of STARS, Shock, Trauma and Rescue, out in Alberta, and they have been running for 26 years. Orange, there was a vague attempt to model Orange after the STARS model. You can't duplicate that. Air ambulance, as I mentioned, is an emergency service. You cannot run an emergency service respectfully with a board of directors, with individuals that may possess a private pilot's license and believe, again respectfully, that they have a knowledge of aviation. Just recently it was announced by Orange that they are going to hire the former head of Toronto EMS, Bruce Farr, on a 6-month contract for consulting. Now, respectfully, he has 30 years experience, and I'm sure he does know something about ground ambulance operations. Unfortunately, he knows nothing about air ambulance operations, and that's been the case with all of the senior managers and middle managers. They may have the best of intentions, but they do not have the operational knowledge of being able to select aircraft, know which aircraft to send, how to manage a comm center. The communications center alone, since 2006, has had 7 directors. They have no idea what they're doing, and when they either give up and quit and or get fired, they get replaced by somebody else up to the current person who was trying to learn what they do on the job by putting pieces of paper taped to a window asking employees to put their ideas up on how air ambulance should be run. I think at this point we're looking for a little bit more leadership than that.
You referred to the quality assurance issue.
Yes, sir.
And around that, one of the issues that we have heard about quite a bit is Orange's mandated delay policy.
Yes.
Could you elaborate on that for us and tell us what the impact of that policy is on patient health?
That had a huge impact. When it comes to helicopter operations, contrary to what people may think, that a buzzer goes off, as you see on TV, and people go running to the helicopter, it doesn't happen like that. When previous to Orange, as soon as a helicopter call came in, this is why you need qualified, very experienced people dispatching these aircraft, unlike today. You need to know weather, you need to know fuel, you need to know operations, you need to know capabilities, and you need to get that aircraft in the air immediately as seconds count. At one point, Orange attempted to put a 10-minute delay policy into place. Their justification for it was that it was going to help save on the canceled call ratio that they were experiencing. In my personal opinion, that's a cover for trying to save money. You cannot have a scene call response with a car accident or a train wreck, and I'll give you an example. Outside of London, last year in a town near Glencoe, a 24-year-old male was struck by a train in a pickup truck and dragged approximately 300 meters. He was trapped underneath the train, still alive. Anybody with half of training in aviation would know that if they're calling and they're saying this guy's alive under a train, pretty good chance you need to get that helicopter in the air pretty quick. At that point, they had their 10-minute delay policy that said that if a ground ambulance was within 10 minutes of reaching that scene, you're to weather check the helicopter, tell them about the call, the area, but do not launch it. So when the ground ambulance showed up on this call, they look at this guy under the train, and as you can imagine, said, oh my goodness, we need a helicopter. They're out in the middle of nowhere. In comes another policy from the Ministry of Health, which is actually a good policy. When they finally mobilize this patient into an ambulance, the rule is if you do not see the helicopter on final approach, you have to start heading to the closest hospital. In Glencoe, there is nothing. It's nothing shy of a clinic. So they transported the patient there. You got to remember, the golden hour is now ticking. The helicopter was subsequently called. The accident happened at approximately 10:45. The helicopter was not wheels up in the air until 11:20. By the time they got to the what they call a modified location and back to the London hospital, it was 12:40. The flight from their base to that scene and direct to London Health Sciences would have been no more than 30 minutes. This patient subsequently died, and I'm not suggesting for a minute that the 10-minute delay response was the sole contributing factor, but you have to agree that you'd have a better chance of survival getting to a hospital faster.
Thank you. Mr. Harness, in your attempts to contact the minister, and you were unsuccessful in doing so.
And you're on your last minute, Mr. Please.
Did you inform anyone else in the minister's office or at the Ministry of Health about your attempts or about what your concerns are at any time, and if so, when did you make those contacts? And do you remember who you might have been able to contact?
I attempted several direct contacts by phone. Nothing ever came back. And I do have a contact in the ministry, and I have relayed all my concerns for the past year and a half to this individual. And I am aware that some information has been met with success and some has not.
But that information or that individual you can't disclose, or
No,
can you?
No, sir.
I think, Chair, what we're hearing today from Mr. Harness confirms the need for a select committee. I think it's very obvious that there are many frontline people who would want to come forward. They're intimidated from doing so. We've heard from Mr. Harness that ongoing concerns are very much still there. And I think it's our responsibility to ensure that we create a forum where people can come forward safely and confidently with the appropriate whistleblower protection so that we can, in fact, restore confidence in our air ambulance service, which is really the objective, first of all, of the Auditor General's report and of the legislature.
Thank you for your comments, and thank you for your presentation today, and we are out of time for your presentation. And our last presenter this afternoon is going to be Mr. Bob Mackey, who's Director of the Air Transport Association. Mr. Mackey, welcome.
Thank you.
And just to confirm that you've read the information provided to witnesses testifying before the committee?
I have.
Okay, very well. And our clerk will go through the oath with you.
You have the Bible? Mr. Mackey, do you solemnly swear that the evidence you shall give to this committee touching the subject of the present inquiry shall be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Very well, and you have 5 minutes for presentation, and then we'll go for questions.
I'll read quick. The Ontario Air Transport Association is a voice for Ontario's commercial air carriers, including those who supply air ambulance service to the Ministry of Health through Ornge. As certified and licensed air ambulance carriers, these carriers have been the backbone of the provincial air ambulance service for decades. I've been involved myself in the air ambulance system since 1978. I have witnessed the system mature from very humble beginnings to where patients are now transported in ministry licensed ambulances. The system continued to improve until 2006. The number of air ambulance bases and aircraft has severely dwindled under Ornge. For example, where northwestern Ontario once had 5 communities with a fixed-wing air ambulance base, there's now only 2. It is impossible to summarize what's transpired since 2006 in only 5 minutes. Really, a hearing or inquiry should be called to allow witnesses sufficient time to bring forward the whole story. The government announced in 2005 that it was appointing what we now call Ornge to work with the ministry to streamline our air ambulance system. The mandate was to increase service, have a single point of contact, and medical oversight. Absolutely nothing in this announcement indicated that there would be changes to the actual procurement of air ambulance services. The air carriers welcomed this announcement as it was going to streamline the system. On February the 23rd, 2006, Deputy Minister Sapsford confirmed before this committee that the actual delivery of aircraft would continue to be done under external contract. He also stated, and I quote, that the Ministry of Health isn't in the business of flying helicopters, maintaining them, and so forth. It is a specialized business that we can provide on contract basis, I would argue, more efficiently and more effectively than we could ourselves. We agree. In that same meeting, Malcolm Bates confirmed that there were, in fact, competitive processes to secure air ambulance services and that Ornge was required to follow those processes. He also agreed with the statement, it is specialized business. The government's initial announcement, testimony to this committee by various government officials, including the Deputy Minister, the committee's report and recommendations to the House with respect to the Auditor's report of 2005, and the actual performance agreement with Ornge confirms that there was never any intent for Ornge to start its own air service. In fact, the report to the House states, and I quote, services are to be provided on a contract basis through external operators, with the expectation that this approach will be more effective and more efficient. What really happened, however, is to the detriment of the existing air carriers and would now appear the Ontario taxpayer. How this came about is even more shocking. In 2007, Ornge issued an RFI to the air carriers. Unlike previous RFPs, this RFI requested detailed proprietary and confidential information. No contracts were to be awarded. The carriers were told in a vendors meeting that Ornge wanted this information to gain a better insight into cost drivers. When queried as to what would happen if a carrier did not reply to the RFI, it was bluntly stated that since the carrier was not working in a collaborative manner with Ornge, they should not expect Ornge to work in a collaborative manner with the carrier. Some call it blackmail. RFI closed on June 29th, and shortly after, on September the 17th, what we now know as Ornge Global Air was incorporated as a for-profit corporation with Mazda as one of the directors. It appears that Mazda took it upon himself to start his own airline using perhaps fraudulently obtained information as well as taxpayers' money to do so. He then gave his new airline business without adhering to government procurement guidelines. In other words, he gave his new airline our business, and we were actually forced to help him. He continued to conspire to eliminate the contracted carriers. He raided our staff, made it difficult to get paramedics trained, and went so far as to tell some paramedics that if they wanted to upgrade their skills, they had to come and work for him. OWADA has repeatedly brought these and other abnormalities to the government's attention. Meetings were held in Thunder Bay with representatives of Minister Gravel's office, MPP Bill Morrow's office, and Ornge. As well, a letter to Minister Kaplan in 2008 expressing continued concerns went unanswered by the ministry, referring us back to Ornge, the very organization that we were trying to bring to the attention of this government. It now appears that the new board is not familiar with its own mandate, and the government has forgotten the mandate as well.
Mr. Delaney spoke to this committee about how dedicated the frontline people they have. Absolutely, we agree. They used to work for us. OADA specifically recommends that Ornge must return to and focus on its original mandate. Ornge Global Air was never part of that mandate and must be shut down. The supply and operation of fixed-wing and rotor-wing aircraft must be tendered in an open and competitive bidding process, as was the government's stated intention. As noted in the auditor's special report, neither Ornge nor Ornge contracted consultants found any significant issues with the carriers. These carriers provide Ontarians with a service that puts emphasis on patient care and safety and provides it at a very reasonable cost to the taxpayer. And I'm happy to take questions.
Very well, thank you. And it's time for the government to go first. Ms. Sandals?
Yes, thank you. When you say you hope that Ornge Global will be wound down, I'm presuming you don't simply mean shutting it down, which is happening. What is it that you see happening?
Well, I think we're all in a pickle here right now, quite frankly, is because it's allowed to manifest itself is because you do have Ornge Global Air now, and they are, because they've put other carriers out of business, have taken the medics and so on, there definitely needs to be a period of transition to go back to where the aviation services go back to where they belong in the aviation community.
So you're recommending that all air service be provided by the standard offer agreement providers?
Standard, no, the SA agreements, there used to be, well, two really different ends. There's the critical care, which was a dedicated contract, and there was the helicopters. I mean, until just like, well, actually, helicopters were operated by Canadian Helicopters Limited until just recently, a few months ago, right? So those Ornge helicopters you see flying through the air were not operated by Ornge. They were operated by Canadian Helicopters. The dedicated fixed-wing contract was operated.
So what are you suggesting then with, I'm sorry,
we go back to the same
I'm
system.
just trying to understand. You're suggesting that the service be automatically returned to Canadian Helicopters?
No, I believe that the operation of the equipment and whether or not that involves the sale of the existing equipment to the operator or leased, I mean, that would have to be determined, but the operation of the aviation assets should be returned to the aviation industry, who know what they're doing.
And the paramedics and the folks who are actually, so you're talking simply about who flies the aircraft, who owns the aircraft. Is that what you're
Well, I'm
talking
in the
about
flying business,
involving?
and very briefly, the company that I'm involved with,
Which is?
I'm the president of Thunder Airlines. Okay, we used to provide advanced care and as well as primary care service to the province under a standing agreement situation. We were the largest advanced care carrier, for example. As a matter of fact, in Dryden, I had a base which didn't cost the government a penny if they didn't use me, staffed 24 hours a day, 7 days a week with advanced care people, and you know, it worked quite well. Under Ornge, of course, that's gone. But as far as the medics go, the original mandate, I believe, back in 2005 to 2006 when it was sent over, was that certain medics would come under the umbrella of Ornge. I have no issue with that. The critical care and or even perhaps the advanced care. Primary care, there's, you know, the vast majority of patients in the province are actually moved as primary care. And there's no need for that necessarily. They're not now under the umbrella of Ornge. They're actually work for the operators.
So you're less concerned about who the paramedics work for, you're concerned about who's flying the aircraft, be they helicopter or fixed wing. So your members are then helicopter aviation services and airplane aviation services are your members?
Members are primarily the fixed wing industry.
Okay.
Okay. There was only really one operator, as we know, in Ontario that was
Who was
flying.
doing helicopters.
Yeah,
So
exactly.
your members are, for the most part, then the fixed-wing operators.
That is correct.
So how many then, so your members then have lost that contract. So how much, or no, there are still some of them.
There's a
Okay,
few
so
left.
how many of your members still have contracts?
I would say there's 1, 2, perhaps 4.
And how many of your members have lost the contracts?
Well, let's see here. Way back when, in 2005, we've lost a total of 6.
And how many of your members have contracts? Of the 4 that still have contracts, are they still the same size of contract?
Oh, absolutely not. With Thunder Airlines, with some decisions that were made in 2006, we elected, as I mentioned, we had advanced care bases, including on-site, which mirrored the government's critical care. That all got shut down overnight when Orange simply changed the protocol and decided to move the responsibilities for paramedics in order to watch. Quite frankly, we suggest that it was probably because he was running out of money at the early stages. He put that onus on the, Mr. Mazza, he put that onus on the various hospitals. So all of a sudden, all of these highly skilled paramedics that we had, trained and certified by Orange, weren't being utilized anymore.
So let's go back then to your members, though, who
Sure.
you're here to represent.
Yes.
And you used your own example. So how much revenue then in contracts with the Ministry of Health or with Orange, as the case may be, over the years, would you have lost?
I think probably in the neighborhood of, I would be shooting from the hip, and I really don't like to do that. But in 2006 down to 2007, my company probably lost about $4 to $5 million.
So, and you're saying that your members would be typically losing multi-millions of dollars?
Yes, absolutely. Like we were, my company was a little bit more heavily involved with the advanced care, so there's much larger investment just in equipment and training and so on. But yes, everybody who was doing advanced care definitely got the pinch.
Okay, so in the model that you're proposing, obviously if there's multiples of you, the tens of millions of dollars then would be returned to your companies.
Well, you say model, but I just go back to what was the original mandate? I'm just saying, go back to what the original mandate that the government specified that they were going to do. We were all in agreement with it. They were going to look after the medics. They needed direct medical oversight. We had this system where you had different base hospitals throughout the province. Like I say, I've been very involved with the air ambulance, starting off as a pilot back in '78, and I saw good things happening. And this was probably one of the biggest good news story was when they did this. They're going to centralize this. This makes sense. We had no issue with it. And they were supposed to continue the contracts. We expected, we'll call it the fixed-wing dedicated contract, which is for fixed-wing service in Sioux Lookout and Timmins. They've since added a machine in Thunder Bay due to the angioplasty there at the Thunder Bay Regional. And same thing with the helicopters. But the operation of those were to continue. The medics were supposed to go in those operations under the umbrella of Orange, which was fine. They actually got downloaded from the ministry back in about 2000, which was a mistake. So they went back and just go back to what the original plan was.
And we are out
It
of
morphed
time.
from that.
We're out of time?
Yes. So we'll move to the official opposition. Mr. Klees.
Thank you. Mr. Mackey, thank you very much. I think you've helped to crystallize a good part of the issue here for us. And again, to go back to a fundamental point, and that was that the vision of consolidating the service and centralizing certainly many aspects, particularly the oversight and the management of that, was at the heart of that original mandate and announcement, and it's what would have been achieved through the original performance agreement. It was all there.
It was all there, and it looked great.
What went wrong, as you pointed out, is that someone decided to take that vision and essentially morph it into a very self-serving business strategy. And it was, I believe, never the intention to create another Ontario fleet of aircraft owned and managed by the province of Ontario.
That's right. There is at least no documentation that I can find where the government made any decision that they were going to tell the air operators in the province of Ontario, who supply services not just to the Ministry of Health, but various other government agencies, that they were going to put them out of business. That was never announced.
I'd like to get to the impact on patient care that decision had, and actually, if we allow it to continue, will continue to impact patient care. Could you tell us how many bases were in place in Ontario prior to this Ornge decision, and how many are in place now, and the impact that that has on actually reaching patients within the appropriate time frame?
Sure. For the record, as I mentioned in my little spiel there, it went from 5 fixed-wing bases in northwestern Ontario down to 2. We now only have Sioux Lookout and Thunder Bay. Red Lake, Fort Frances, and Dryden have gone by the wayside. The rest of the province, we no longer have Hearst, Kapuskasing, Sudbury, North Bay, Sault Ste. Marie, Kingston, Toronto Island, London, or Toronto-Buttonville. Those were all places that had fixed-wing air ambulance service. And just so recently as this past fall, when the operator out of Fort Frances actually moved his operation to Manitoba, and there was a need to get a patient out of Fort Frances. Well, being the fall, the weather's not very nice. Well, if you fly, you know that quite often you can take off, but you can't land. It took 2 days to get that patient out. If that operator had still been there would have been no issue.
And so there's a significant impact
Absolutely.
on patient care. So apart from the fact that the government has essentially moved in and stripped a lot of independent businesses of their business and the economic loss that goes along with that, we have the impact on the other side on patient care. Can I ask you this? This has been scrambled now. How do we unscramble this mess? Is it a matter of, and I think Ms. Sandals asked the question earlier, she said, well, you know, is it just a matter of now returning it to the place where it was? Or, I'd suggest, and I'd like your thoughts on this, that one option is that we do what hasn't been done before, at least under Ornge, is that we respect the procurement process of the province of Ontario and say, look, you people who are in the aviation business, come forward under an appropriate RFP, tell us what your expertise is, tell us what it is that you can do to deliver and restore confidence, restore the actual services that we need, and do so under a competitive process so that we know we're getting the best value for a dollar. Is that a reasonable option for us to consider?
Absolutely. I mean, obviously there's going to be a transition period. I mean, we just can't leave the people of Ontario without an air ambulance service. That's obvious. So, but yes, I mean, the air carriers are more than willing, able, and capable of doing exactly what you said, including the rotary wing.
I've heard, and perhaps you know better, that there are a number of pilots who have left Ornge. There are others who are contemplating leaving, and the reason is that they do not have confidence in the management level at Ornge. And the implication of that, could you talk to us about that? If you don't have the pilots, and there are only so many pilots in Ontario, what's the implication to our air ambulance service?
Well, it's I can't speak directly to the number of pilots leaving Orange because I just hear rumors and innuendos, but obviously that also happens in the industry as far as pilot movement goes. As I think, like anyone, they're nervous. They're seeing what's going on. They're seeing this hearing going on. They're reading the Toronto Star and watching the TV, and they're seeing things, and so yeah, they've had issues with their management. They've had issues with their senior management. Some of that has been changed. Unfortunately, the part of the problem is, and from my perspective, is that, I mean, with all due respect to Ron McCurley, he got parachuted into a pretty big mess, but it wasn't one of the normal messes that he was usually set to clean up. This is the aviation business. I've been in it for 35 years, and I've seen lawyers and I've seen doctors quit their practices because they wanted to start an aviation company. None of those are in business today.
Including Dr. Mazza.
Apparently. And, Dr. Mazza, I've actually known Chris Mazza since the mid-'90s when he first became involved, because I was sitting on a committee for the Ministry of Health that was a result of the air ambulance review. And even back then, all he could talk about was, he loved this particular aircraft, the PC-12, because he actually went down to Australia and flew a little bit with the Royal Australian Flying Doctors, I believe it's called. So he had a vision. I mean, he definitely had a vision. And I was sold. I was sold up to 2006. And I did see improvements up until that point. But it was when he became, how should we say, in charge and fiscally responsible, it kind of went downhill.
So what was lacking was the accountability mechanism to oversee what was an original vision that actually should have and could have worked.
Yeah. Well, as I said, the mandate as announced by the government in 2005 was sound. It was sound. It just somehow it went from this, it went from the Deputy Minister Sapsford saying, we're not getting in the aviation business, we're going to fix this so that we know how to send these airplanes out in helicopters, know how to dispatch them, know how to get them back, know that the medics are well trained, know that it works and clicks, but leave the aviation part of it to the aviation professionals. Suddenly somebody thought, at least from my perspective, I have an opportunity to start an aviation company. That's what happened. But people are taking that as they accepted that the fact that he did that. There is nothing, at least that I can find, and I would love for somebody to point out to me where the government changed direction, what decision was made, who made it.
And we are out of time for the opposition. We can move to the NDP, and who would like to ask questions over there? Mr. Singh.
Thank you very much. Mr. Mackey, thank you for taking your time. Mr. Mackey, if you could just highlight, if you could just break down the specific areas where Orange fell short of providing patient care and why the Orange model was worse than the pre-existing model where the aviation was left in the hands of the independent carriers.
Okay. Patient care, well, let's, where am I going to start with that? I'm a pilot, first of all, and I operate an aviation company. We are definitely concerned about patient care because we are also a licensed certified air ambulance company. However, all of our medics are, and actually Mr. Bates mentioned today, I'm just going to fit this in here today, that the Ministry of Health certifies and licenses paramedics. That's absolutely true. Didn't go so far as to say is that you don't fly for Orange unless you're also trained and certified by Orange. It's another process that's on top of that. So it's not just that some land paramedic can get in the back of an airplane, or even anybody who's written the provincial exam. There's another step. Patient care, in a lot of aspects, as far as the ability, the number of functions that paramedics, especially critical and advanced care paramedics, and even to a certain extent primary care paramedics, are allowed to do, has increased over the years, without a doubt. Where patient care has probably gone backwards is that we are no longer, I believe part of the mandate was to increase availability of air ambulance in the province. So I think I just named 13 bases that were now closed. So that in itself has to hurt patient care.
Okay.
You know, you have Orange aircraft now based in fewer aircraft. So these aircraft that you now have left have to fly that much further. It's not uncommon for my company to get called up to leave Thunder Bay to go pick up a patient in Moosonee to take them to Timmins.
Okay. You expressed some concerns about what was going on in Orange.
Yes.
You expressed those concerns to the Minister of Health. Is that correct?
One of our members wrote a letter to Minister Kaplan.
And when was that letter written, and what was the content of it? Basically, what was said?
Well, I can submit that if you like.
Yeah, that'd be great.
Or not.
So you could perhaps if you could table that.
Yeah, I can table the correspondence to that end, sure.
Certainly, and if, to save time, you can do that at the end.
Yeah, that's fine.
Just provide do you know roughly when that was written?
Well, it was 2008, I believe it was in the summer of 2008. It took months for an answer to filter back.
And what was
it? It actually got to the minister's office through Minister Gravel's office locally in Thunder Bay, and then forwarded to Minister Kaplan.
And so you mentioned Minister Gravel. What was Minister Gravel's involvement? Did you complain about Orange to Minister Gravel?
We were complaining. We had numerous meetings. One meeting with where Orange attended with council.
Yes.
In Thunder Bay, and it was Minister Gravel himself was not there. He sent a representative of his office there.
Okay. And what was discussed at that meeting?
The operators, and these, by the way, include operators who are not air ambulance companies, but saw problems helping, or on the horizon, I guess. And very same thing. What's the government or a government-sanctioned entity getting into aviation? It's, you know, you're going in, you're being a competitor with private enterprise, and you're stealing our people.
So you expressed that concern with a representative of Minister Gravel's office, with Orange officials there, with council, and with yourself.
Yes.
And did you address any concerns with the actual quality of the care being reduced and problems with Orange itself?
Quality of care, no.
Okay.
No patient care issues were really brought up in those meetings. No.
It was just a conflict of interest, or
it was a conflict of interest, and it was against what was the mandate. And I'd like to go so far as to say is they were sneaky how they did it. Okay, can I be blunt? Okay, yeah. Very, very sneaky. As I mentioned, the RFI that came out. That vendors conference was at the Sheraton Hotel at Pearson Airport. The operators were just livid in that meeting. What are you doing? We had to give our contract fuel prices, which are highly, highly confidential. With our contracts that we do with Imperial Esso, we had to turn that over to Orange or we wouldn't get any more further contracts. You know, like, what's with that? They also went on to, oh no, we're not buying airplanes. We just want to do this. We just want to do this so we get a better understanding of the aviation industry. Meanwhile, I'm on a safety board with the National Business Aircraft Association. I'm in Orlando, and I think it was 2006 or 2007. There's people down there already shopping for helicopters and fixed-wing airplanes. You know, so, I mean, aviation is a small business. They started making noises, they were shopping, like we knew the same day.
Okay, and just to build on that, so you were concerned with Orange getting into the aviation business. Was there a cost associated with, or cost savings associated with the previous plan versus Orange's plan?
Well, let me put it this way. You had 13 more bases. You had an advanced care 24-hour base in Dryden. You had more advanced care service. You had all these aircraft. I think Malcolm Bates in 2006 said there were 25 aircraft available at any given time, and they were only spending $97 million. It's a far cry with what's being spent today.
Okay, that's excellent. Thank you.
And you have a minute and a half.
Just a few questions. Am I right in thinking that the Ontario Air Transport Association actually wrote to Minister Matthews, the present Minister of Health, in May of 2011? That would be about a year now.
Yes, that's just correct.
Okay. Do you remember the content of this letter?
Not precisely. It was the president of the association that sent it out. I've read the copy, but you have to beg with me. I've got about 180 hours worth of research just into the last few weeks, but I can actually give you a copy of that letter. I don't have it with me here today, but I can put my hands on it.
I would really appreciate if you could table it. In your experience and knowledge, you know what's going on with Orange right now. It has become a scandal. I take it you read the papers just like the rest of us and watch TV like the rest of us. Did you see this coming?
Yes.
And when did you see this coming?
Well, I probably saw it coming 3, maybe 4 years ago. And what we saw was a house of cards being built. And this house of cards had no way of sustaining itself, and that it was going to collapse. It didn't collapse exactly the way I thought it was going to, but it was not sustainable with what they were doing.
And could you tell me some of the pieces of the house of cards that you knew about?
Well, the fact of the matter is, and I think
And you have a minute left.
Okay. The previous person mentioned, unfortunately, you have, again, an aviation company being ran by people who didn't know an awful lot about aviation. And it was also obvious, because as time went on, we see, on September the 16th, 2007, that he's starting a for-profit company. As a matter of fact, I was in a meeting with Orange in Thunder Bay. The operators that have been called by Orange, and they had their counsel there. They had the head of the MAC at the time, which was Dr. Bruce Sawatsky there, and along with Rick Potter. And it came up in the meeting, I forget how, but I asked them, I said, well, they were trying to say, well, we want all this information, we want to work with you. And I asked them, I said, well, what about 878, and I forget the number now, Canada Inc. What's this? And they had no idea. The council had no idea. So, well, this was the for-profit company that you guys just incorporated a few months ago. Okay? It's going to be Orange Air, because we know that you've applied for an operating certificate. We know that you've applied for to the Canadian Transportation Agency for an operating license. This is all public knowledge. So it was like they could go about and do whatever they wanted with no oversight and no accountability to anyone. I actually laugh about this. I've been, somebody just yesterday, and they said, well, how is that? And I said, my answer to them, and as simplistic as it is, I said, you see it's a nice blue sky out there? They could walk into the room and tell you that that's a purple sky, and you were expected to believe it. It was their way or no way.
And thank you very much for your testimony today.
Okay.
Appreciate you coming. And a couple of items before the committee wraps up. Next week on the 25th, I'm informed by the clerk that we have plenty of people to ask to come before the committee from our existing list. So the clerk is going to work on lining those people up. But that we would start at 8:30 a.m. on Wednesday, so that we have some time to deal with motions, etc. And I anticipate a subcommittee meeting to look at future witnesses as well. And we have the two people we missed today, which were Tim Shorthill and Barry McClellan, will be scheduled as the first two people on Wednesday.
Do
Yes,
we have
Mr.
time
Please.
for me to bring forward two motions? They're just witnesses that I'd like to have called.
You can. We have a number of them. You can table them with the committee, and we will deal with those on Wednesday.
I'll do
next
that.
Wednesday. Thank you. This committee is recessed.
This is the Ontario Parliament Television Network.